Good afternoon and happy Asian American, Native Hawaiian, and Pacific Islander Heritage Month. My name is Catherine Keatsman, and I am an Associate Center Director at the UCLA Center for Health Policy Research and Director of the Center's Health Equity Program. I'm also an Associate Researcher in the Department of Community Health Sciences at the UCLA Fielding School of Public Health. As a land-grant institution, we would like to begin by acknowledging the Gabrielino Tongva peoples as the traditional land caretakers of Tuvangar, that is, the Los Angeles Basin and South Channel Islands. Thank you all for joining us for today's webinar, during which we're going to launch a new and improved Native Hawaiian and Pacific Islander Social Determinants of Health dashboard. The dashboard now shows detailed data on the health and factors that shape health across all of California's 58 counties. It also features improved design, layout, functionality, and content to make critical data easier to find, understand, and use. We're so fortunate to have presenters from the NHPI community joining us today to give us a sample of how it works and to learn more about how accessible, culturally grounded data strengthens their advocacy, planning, and storytelling. Next slide, please. As a reminder, today's webinar is being recorded and will be posted to our YouTube channel in the coming weeks. If you would like a copy of today's slides, please email our communications department at healthpolicy@ucla.edu. I will now turn things over to Calvin Cheng, Director of the Native Hawaiian and Pacific Islander Data Policy Lab, who will introduce our speakers and get us started. Calvin?
Aloha mai kako. I'd like to start out with a brief cultural grounding. A quote from Maupilig, the master navigator who helped the crew of the Hokulea learn how to wayfind. And he once said, if you can read the ocean, if you can see the island in your mind, you will never get lost. Native Hawaiians and Pacific Islanders have spent thousands of years using and combining observational knowledge gathered across numerous topics through the practice of wayfinding, which guided our ancestors to each other's islands across the Pacific. Reaching our destinations involved a complex system that combined disparate topics like the order in which stars appeared over the horizon, recognizing the direction of ocean swells, and tracking marine life habits, all with awareness of how our communities, history, and environment are intertwined. Today's presentation features a dashboard relaunch that provides our communities with both updated and new indicators that we hope will also help guide our NHPI communities and the organizations who serve them. I'd like to welcome our wonderful community speakers, Lucy Latu from Taulama for Tongans and Alisi Talua from SoCal Pickard. Lucy Latu is the Assistant Director for Taulama for Tongans, a nonprofit organization serving Pacific Islanders in the greater San Francisco Bay Area. He is a community health advocate, facilitator, equity champion, and lifelong learner dedicated to empowering Pacific Islander communities. We'll also hear from the NHPI Data Policy Lab staff responsible for updating the dashboard, Freya Paul, our research data manager, and our intern, Julie Young. But for now, please join me in welcoming Lucy.
Thank you, Calvin. Hello, everyone. Good afternoon. Like Calvin said, my name is Lucy Latu with Taulama for Tongans. We are a community-rooted nonprofit organization here in this greater San Francisco Bay Area. We uplift Tongan and Pacific Islander families through culture, language, and community, providing accessible services, education, and advocacy to advance equity, eliminate disparities, and foster collective health, resilience, and well-being. Next slide, please. So just to full disclosure, Calvin is my data superhero, so I just wanted to share that with everybody. About a year ago, Taulama was putting together a webinar with regards to data, and while creating this webinar and the presentation, I was mulling over what it would be called, and in our Pacific Islander culture, we are family-centric, community-centric, and I feel it's like a variation on the minority myth that plagues our community. And so I have been very like particular as, not to appear aggressive, because in our culture, aggression is being viewed as being disrespectful. But then there's the American side of me that says, like, stand up for my rights, squeaky wheel gets the oil, and closed mouths don't get fed. But for our NHPI communities, we find out that we are unseen, unheard, and ignored. And so with this webinar that we had created last year, about a year ago, it was really to that point where we as NHPI communities, and even if it's within my own family, like, accepting crumbs when we should be having the whole pie or the whole cake. And so I had to mull it over and realize that being unseen, unheard, ignored is a reality that we have to live, that we live in every day. And because NHPI, our communities are often grouped into a broad racial category, which means that our stories, struggles, strengths, and needs become invisible. And decisions are made without truly understanding who we are. And, if you can't see me, then how are you going to help me? Next slide, please. So a year ago, when we were creating this webinar, it was in partnership and coordination with the UCLA Center of Health Policy Research and the NHPI Data Policy Lab, where we conducted the webinar, Unseen, Unheard, Ignored, a Data Crisis for Native Hawaiians and Pacific Islanders in San Mateo County. It was during this webinar where we highlighted improved data tools specifically for the NHPI community in California. And it was created by our own. And I know I'm decades late, but the whole idea, or the whole reason for like the FUBU, for us, by us, and understanding that this was going to be a space where we could discuss data inequities, the impact of aggregation, community invisibility, why disaggregated data matters, and the importance of culturally grounded storytelling. Next slide, please. And the reason why it was so important was because this is where I realized, especially in the work that we do is serving the community, is that data is the language of funders, of government, of these entities. And data, at the end of the day, is what influences funding, policies, public health priorities, resource allocation, community investments, and program development. But with our community, the NHPI community, when we're invisible in the data, our disparities are minimized, our needs are overlooked, and our communities become an afterthought. And that is true in the sense that, for an example, would be a Tongan male that has diabetes, a patient here in San Mateo County, and he spoke English conversationally, but not medical term-wise. So when it came down to a medical appointment and they were trying to explain to him what refill was, or asked him if he understood what refill was, and he said yes, but he didn't. So he was waiting for 3 months before he was seen again by the doctor. But in Tonga, we have a hospital, but patients just, get their medication. They don't do refills, but you go see the doctor, you get your medication, but you can be seen the same day. And so he ended up hospitalized because he ended up having what was it? Hyperglycemic episode. And so it was because he was waiting to see the doctor before he could get his medications. But it was that language barrier and that cultural barrier that existed between the medical staff and this patient that nearly cost him his life. Next slide, please. And for me, with learning how to pull data, which is what Kristen and Calvin and Shreya had taught me, it really helped me to feel empowered. And I don't know about you all, but culturally, the feeling of we're family centric and community centric, where the group is prioritized over the individual, and so not feeling like a burden is a huge thing, at least for myself. And so being able to feel empowered because I could pull my own data and utilize it the way I needed to was awe-inspiring. Like, I feel like I'm a data nerd now because of what Calvin and Kristen and Shreya have done to me. But now I'm able to pull meaningful data and explore county level realities and identify disparities and support the community stories, because in our culture, oral history and storytelling is part, we say it like, oh, let's go talk story, or and that's natural for us, but the data was lacking. Like, we don't have the data. And so for funders and for government entities, it's critical to have the data to prove that, our stories, or to validate the stories that we had that's happening in the community. And so that was what was focused upon. And so it really helped me to feel empowered. So now I can like pull data all the time, but I really appreciate it because it made me feel more independent and empowered. Next slide, please. And like I said, like, data has helped me tell our story, because we as a culture, they say that gift of gab, but it's embedded in us to be able to talk story, because that's how we communicate. And that's part of our history, is that we had oral history. We didn't write it all out, but it, even when we're sharing a store or something that we eat, it's like automatically when we say, oh, hey, check this out, we're vetting for that product or for that service or for that person. And so recognizing that data alone is not enough, stories alone are not enough, but together data gives credibility, stories give humanity, and community gives context. And it is our duty as community leaders to transform numbers into narratives that drive action. Because I have used this analogy where data by itself is really dry. It's like a sandwich without the meat and the fixins. So it's just like bread, really dry. And then the community voice is like the meat and the fixins. But if you don't have the bread to hold it all together, it's messy. So you need to have both. You need to have the bread and the meat and the fixins together, and you can eat it, and it's yummier that way. Next slide, please. And all of this was enlightening. It felt validated in the work that we were doing, because we finally had the data, and it matters. The representation where NHPI communities are disaggregated, we become visible. Access matters. Communities that should not need advanced research training to understand their own realities. Community voice matters, because data should be used with communities, not just about. Like, one of the worst experiences that I've had is when it's someone else trying to tell my story or our story, when they have no reference point, or it's not their reality. And our storytelling matters, where data becomes powerful when connected to people, families, and lived experiences. One of the defining characteristics of a Pacific Islander Tongan is the heart. And we can all feel or tell when someone's heart is not in it. And, in my Tongan community, if you don't have heart, then you feel it. Like, when someone speaks and they're not speaking from the heart, you feel it. Like, you can't falsify that. Next slide, please. And then using the data, like, now I get to pull this data for grant applications, advocate for equitable resources, inform public health conversations, elevate the NHPI voice, and build stronger culturally grounded programs, as well as educate partners and decision makers. And all of this was done because of a community needs assessment that we conducted in 2022 of the Tongan community here in San Mateo County. And I could use all the data that was pulled or that was gathered from that community needs assessment, but then realizing that there was no context. And the reason for the need for the NHPI dashboard was like people or funders in the government may have heard of what Tongans, but they would not know, or they didn't know what the realities that the Tongan community was facing, such as more than 50% of the community was using more than 30% of their income for rent, and how the households were not just a single family household, but multiple family household, because here in San Mateo County, it's the fourth richest or wealthiest county in the nation. And so our community is their earning power is at the lower part of the spectrum. And so it required more people in the household to be working in order to be able to just barely survive. Next slide, please. And so being visible in the data is only the beginning, because now that we are switching to where we can disaggregate the data that is collected, it just highlights the need for us to invest in NHPI communities, expand disaggregated data collection, build community research capacity, include community voices in decision making, and fund culturally responsive solutions. Again, if we are not seen, if we're not identified, we won't be helped. And they say, if you're not at the table, then you're on the menu. And I don't know about you, but kind of tired of being on the menu. Next slide, please. And so being able to utilize the dashboard and utilize the data to tell our story has helped me understand and realize that it wasn't that we were lacking stories. We have plenty of stories in our community. It's that we were lacking visibility because the data wasn't there, or the data wasn't disaggregated in order to identify us and what our realities were. And so what I've gained is that the more we learn to access, understand, and use data, the more empowered we become to advocate for our people and shape systems that truly reflect our realities. Because it is, again, if you can't see us, then you're not going to be able to help us, or you're not going to be able to relate to the issues or even identify the issues. And what has really, really helped me is just being able to reaffirm and validate our stories. Because I have stories for days, but the data wasn't there. And now that with the dashboard, it's like, aha, we finally make sense. Like, and it's beyond just what I'm telling. It's data that has been gathered by the U.S. Census, CHIS, and these are all validated and respected data sets. And so I'm really grateful to UCLA NHPI Data Policy Lab for helping, because when I first started pulling data and being able to, I went straight to the census, and I thought I broke the census, but it wasn't. It was just because I was trying to pull too much data at one time. But I really appreciate what Calvin, Kristen, and Shreya have done, and they have made me into a data nerd, and I am really grateful for that, because without them, I would be still trying to I'd still be blind and still trying to make things make sense. But I want to thank UCLA for providing this tool for us and for allowing me to feel empowered to help the community that I'm from. And so with that, I wanted to also to introduce Alice Hugua, who's the Executive Director of Southern California Pacific Islander Community Response Team, or SoCal PICRT. Alice's current priority is to build SoCal PICRT to serve and support our Native Hawaiian and Pacific Islander community meaningfully and advocating for visibility, inclusion, and equity. She will talk about what sets the lab's new dashboard apart and what it changes for our organizations and communities. Alicia?
Thank you, Lucy. Malolele, everybody. Good afternoon. I'm not sure why I'm shaking because I've been among many of you many times, but I'm honored to be here today to share just my experience and why I think the dashboard is a worthwhile tool for your work, and not just for NHPI organizations, but for anybody that is seeking to understand our community, work with our community, and help us create impact for our people. So it's an honor for me to be here as the executive director of SoCal Pickard. But also beyond that, I think Lucy and I have agreed to be the co-presidents of the Data Policy Lab's fan club. So if you would like to join us, let us know. All we do is nerd out about data that we now have access to that we didn't have access to before. But I'd like to open up with a quote from Tongan scholar, Dr. Hufanga Augustino Mahina, in a paper that he wrote about the making of Tongan art. And I want to share this because I hope that by the end of my short presentation, I convince you that this isn't just a dashboard, it's a work of art. And the quote is, in making of Tongan art, process always precedes outcome. Quality precedes utility, and beauty precedes functionality. And I think these are all things that have been captured in the process of creating the dashboard, as well as the dashboard itself. But I will convince you in the next 5 or so minutes. But before I get into that, I just want to make some acknowledgements of all of you that are here today. This is a evidence for me that this matters to more than just Lucy and I, and particularly pay my respects to some of our elders that are here who paved the way for this work, who helped me understand why this is important. So I saw Auntie Kala Pang is in the audience. I hope that you're proud of the work that the lab is doing in continuing the fight that you and Uncle Vic carried and taught us about. Also to Auntie Audrey, Heidi, and then all of you that are in organizations that are constantly seeking for this visibility. So it wouldn't be my presentation if I didn't cry at the very beginning. Next slide, please. One of my most favorite thing about the dashboard is that I don't feel like a footnote when I'm going through it. And today is a relaunch of a dashboard that was created already. I had the privilege of spending 2.5 years working at the Data Policy Lab, where I got to see the process of how this was created and be part of the process and continue to bring community voices and input into this process. And so I am just really proud that we got to address some of the issues that we usually see when we're seeking out some of our data. First, most of the time, as you all know, our data is aggregated. And so this dashboard is one of the ways that we're addressing this issue of aggregation. It disaggregates our data and allows for us to see a true picture of our community. Second, when we do appear in data, it's usually on the very last page of whatever the section is. And it's usually a couple of tables and maybe one sentence. And the dashboard centers our community. It centers what we need and the information that we need. And then third, even when the data exists somewhere, it's inaccessible to us. A lot of times we've had to download spreadsheets, figure out what the numbers mean, and then take that to create graphics and visualizations to make it useful to our work. The dashboard addresses that issue also. This is why I have been using it for the past couple of years that it's existed in its original form. And today we're relaunching it with additional work that has been done by the team at the Data Policy Lab. Next slide. So I want to highlight some design choices that were made that for me changes the way that I interact with data. One, this dashboard was community informed. There was time and given to learn from community leaders and organizations what exactly they need. And that information then informed how the dashboard was developed and the information that is in it. Number two, our community is the leading thought in the dashboard. We are not an afterthought. And you don't feel like that when you're using the dashboard. You actually, for me, I feel seen and celebrated in the data when I don't have to scroll through pages and pages of a report just to find a couple of sentences about our community. We are at the forefront of this dashboard. It's why I'm a big fan of it. Even the visualizations of the dashboard is clearly made to center our community and our data. Number three, it provides community. It is rooted in community context and informed by community context. And this is one thing that I will emphasize on in the next slide. It gives you the right numbers for our community with the right story. Things, for example, like using providing per capita income when you're looking at the economic state of our community rather than just median household income, which is what is normally used when you're looking at economic data. And this makes a big difference because it takes into context our community's realities. Number four, there is granularity in the data that is provided when it is available. There are many data points here that actually breaks it down into some of our ethnic communities. So you will see some Chamorro data, you'll see Samoan data and Tongan data separated out. So you get to not just see the NHPI data itself, but be able to have in your hand data that is specific to the communities that we serve. And for some of our organizations, that is really important because we serve specific communities. Number five, there are plain language explanations, and we laughed about this the other day. This is the first dashboard I think that we actually advocate for text to be available alongside the visualizations and the graphs and the diagrams that we are often we usually see when we're looking for data. Most times you see an asterisk and then you have to look for the explanation for the asterisk, which for our small community who have don't always have the data that is stable for our community, it actually explains to you why the asterisk is there and why our data might not be available, but we have the visualization presented anyway. Because I think it's important to show that the data is absent and why it's absent. And that's important for us as advocates, because then we have the language to be able to advocate for initiatives that support data equity. And then number six, this is rooted in NHPI expertise. If you haven't met the staff of the Data Policy Lab, it is led by folks from our community. And so the thinking through the work that the lab does centers our community. And I also have to thank Dr. Ninez Ponce, the director of the Center for Health Policy Research, for her leadership as someone that has always championed our community. And so it's not just that we have NHPIs at the lab, but we have people who have championed our community at the lab that contribute to the development of these kinds of tools. Next slide. And this is just an example of why the data matters and why community context matters. And as I explained before, most data that talks about economic state of a community uses median household income. And we know in our community where a household is composed of multiple families, which means multiple income earners, this piece of data doesn't always represent the realities of our community because if you have a lot of earners in a household, then the median household income would be much higher. It's not the reality because we have a lot more people in the same household. So per capita income becomes what's more accurate about our community, or tells a more accurate stories about the realities of our community. This was really important during COVID, where resources were allocated based on indices that used median household income in their calculations and in their formulas. And we had to advocate for a consideration for to use per capita income, because many times when you use median household income, our communities missed in those considerations. And so the dashboard gives you this data, and most times it's harder to find that. You might have to go find the raw data and make calculations yourself to get household per capita household income. But because the lab is informed by our community, they have included data like this that tells a more accurate story about our community. Next slide, please. So I can say in my work and in the ways that I've used the older version of the dashboard is that this is what changes for our organizations. Most times I use the data is for applications for funding. You can use the data as you need it. So you can use the aggregated NHPI data, or you can use some of the granular data where it is available. This makes for stronger grant applications, and we all know how difficult funding is today for our organizations. So the dashboard gives you a tool that provides information that can make stronger cases when we're asking for resources. There's smarter program design. Again, the data helps you think through approaches that you need to consider if you are targeting specific communities or working on specific issues. You can be confident that about the information when you are doing community education, because, you know, as Lucy said, we know how to tell stories. We have many stories. But what makes a stronger story sometimes in this work is the data to back it up and to support it. And last but not least, we know that the work in our community is supported when we also do advocacy to change the systems for our not just for our organizations, but also for our community. And so the data I have used many times to create advocacy talking points. And this can be applicable at the county level, because this dashboard provides you county level data, or you can also make comparisons between smaller, the county level and the state level. And so it has been really useful for me to be able to pull data to make those kinds of comparisons when I'm doing advocacy work. Next slide. And so with that, what changes for our community, because the data helps our organizations in our work, is that we stop being the footnote and we stop being the afterthought when you're using this dashboard. Our economic story, our educational story, our health story, they finally show up with the same depth that you usually see for other communities, because now we have the data to back it up. And that makes a difference for our community. It makes a difference when you look at policy and funding flows. Funding, as I said before, funding formulas and government grant making and decisions on allocating resources are driven by data. And so when our community is visible in this way through a tool like the dashboard, resources can actually flow more easily and hopefully more plentiful into our organizations and into our community. Granular ethnic data means interventions can respect the distinct histories of our communities. And if you're familiar with our community, we had our origin stories with regards to migration to the US are different depending on which community you're talking to. And so to be able to respect that and use data to support it is really important in making a difference through our work. And last but not least, there's self-determination in the data, because our community informed it and helped to shape it. The dashboard offers and answers some of the questions that we had ourselves. And so data equity doesn't feel as abstract when we are centered in the data. Data equity actually feels like a reality when you're looking at a tool like this that centers our stories. So what do I encourage you to do with this next slide? I'm excited to see the presentation of the dashboard itself. So I encourage you to visit the dashboard. It's easy to navigate, click through it. I know I get really excited when I look at data that I hadn't seen before presented in this way. So visit the dashboard. I encourage you to bring it into your work, bring it into your presentation, especially those that are from our community and our organizations that are here. And then share it with your friends, share it with other people so that they can also use this tool. Last but not least, and this is really important, is if you have feedback, the lab is really accessible. Send an email to Kristen or Calvin or anyone on the team, and you can trust that the feedback that you give is going to be considered and you will feel heard. And so with that, the last slide, please. I'm just really excited that I get to share how much this has meant to me as a tool. And I encourage you to reach out. And if there's a funder in the room, I also encourage you to check out the dashboard and set up some time to talk story with some of our organizations. As you all know, funding is really difficult today. In today's landscape, and our communities are struggling to keep our doors open to continue to serve our community. And with that, thank you to Data Policy Lab and your staff. Thank you to Dr. Nunez Ponce and the team at CHPR, Tiffany and the comms team, and everyone that has supported our work so far. And I'm passing on to Shreya.
Aloha everyone, my name is Shreya Paul and I'm a research data manager with the NHPI Data Policy Lab, and I'm very excited to share the new Native Hawaiian and Pacific Islander social determinants of health dashboard. So why this dashboard? NHPIs need accessible and accurate data, as has been spoken by Elise and Lucy. And too often, NHPI communities are grouped into larger racial categories, making disparities difficult to identify and address. Existing public-facing data tools remain inadequate for NHPI communities. Most dashboards either do not disaggregate NHPI data meaningfully, they lack contextual text to support community understanding, or are designed for technical audiences rather than for community users and advocates. Through our data dashboard, we want to include NHPI communities' input throughout the development process. By doing so, we want to improve NHPI communities' data capacity, tailor it for the community, and incorporate iterative community feedback into the development process. Our dashboard also aims to address NHPI data characteristics such as smaller sample sizes, which have been labeled as unstable or suppressed in our dashboard for ease of community use. Our goals for the NHPI SDOH dashboard is to make it a sustainable, regularly updated, and well-documented product. We have made some substantial changes to the dashboard this time. The previous versions of the dashboard were built as a one-off product because we had gotten a grant from OMH previously to build this dashboard, and the dashboard was a deliverable of that grant. But over time, our team wanted to keep the dashboard alive and wanted to keep regularly updating the data and add new topics to the dashboard. Therefore, we decided to change the layout of the dashboard a little bit so as to make data updates easier on our end. By maintaining the dashboard in this manner, we want to increase the visibility of NHPI communities in California. We want to provide county-level data for social determinants of health indicators. We want to highlight differences across NHPI subgroups where possible and whenever data is available. We want to support community organizations in advocacy, funding, and program planning using data. And finally, make data accessible and easy to find and use. A big team works together to make this data available and accessible to community members, and I want to acknowledge their efforts. While many of us are presenting in today's webinar, many others work behind the scenes. Mahalo to the NHPI Data Policy Lab team for collecting, cleaning, and presenting the data, the communications team for helping design the dashboard and making it user-friendly and accessible, the data review team for ensuring the accuracy of the data that we present, and our editor-in-chief and PI for overseeing the entire process. I also want to thank the California Endowment, whose grant support has helped us to sustain this dashboard renewal process and work. And of course, thanks to Alicia and Lucy, who have so graciously given us feedback on the dashboard and are also presenting with us. And finally, Dr. Catherine Keatsman for co-presenting with us today. So this is the new look of the social determinants of health data dashboard. For this release, we are releasing data on all California counties. The first step of the dashboard is to select the county that you want to view the data for. And I will go through this in more detail when I'm doing a small training on the dashboard. The second step, you will select the topic that will take you directly to the dashboard. I want to point out that on this page, both the bold topic names and the bulleted subtopic names are clickable and takes you to a dashboard. These topics remain the same as the previous version of the dashboard, except we have added a section on housing cost burden, which is a new topic for this dashboard. We hope to be adding more topics to this dashboard in the future, and we welcome your feedback on the same. Data sources. So the dashboard uses the latest available data. We have refreshed the data sources for the dashboard in this release as well. This version of the dashboard uses data from the Census Data Application Programming Interface API that gives the public access to raw statistical data from various Census Bureau data programs. We use the API to pull data from 2020 to 2024 American Community Survey 5-year estimates, which is still not available on the Census Bureau website. When you visit the dashboard, you will notice that the NHPI detailed race group data still uses the 2017 to 2021 American Community Survey 5-year estimates. This is because that is the latest data that was available for the detailed categories. The other data sources include the 2020 decennial census, which gives actual count of NHPIs in the California counties and not estimates. And the other data sources are California Health Interview Survey, where we use 8 to 10 years pool data to get stable estimates, and California Department of Education data. So I wanted to put a slide together to show how data pooling works. So this slide shows how we pool data across multiple years of California Health Interview Survey to increase sample sizes and improve the reliability of estimates for NHPI communities. Each year draws a sample from the larger California population, and by combining multiple years of data, we are able to produce more stable and representative estimates that may not be possible using a single year alone. Coming back to the dashboard, we have optimized the dashboard for viewing on desktop, tablet, and mobile. There's no extra app needed to view the dashboard on these devices. Now I will stop sharing my screen and go to my browser to do a dashboard walkthrough. So Tiffany will be sharing a link to the dashboard. When you go to the link, you will land on the dashboard homepage. And the homepage has two steps. The first step is choose county, and the second step is choose topic. So using the first step, I can choose a topic of my choice. For the first round, let's select Los Angeles County. After selecting the county, we can go to choose topic, and here both the bold topics and the bulleted subtopics are clickable and goes to a different dashboard. So suppose we want to see the demographics data for NHPIs in California counties, then we can select demographics dashboard. And on clicking on the dashboard, our screen goes to the demographics dashboard in Los Angeles County. Here at the beginning, we have a small text which describes the dashboard. Here it describes the alone versus alone or in combination for demographics of NHPIs in Los Angeles County. And it also shows a couple of visualizations. After viewing this dashboard, to change the county or the topic, you can select the yellow button at the top which says Change County or Topic to go back to the home page. When I click on this yellow button, I go back to the first page, where again we have an option to select the county or choose another topic. So for the second round, let's change the county. So we are selecting Alameda County. And in step 2, let's select a subtopic. Let's select our new section, which is the housing cost burden. It's located under the housing section. So as soon as I click on the housing cost burden dashboard, it takes me to the housing cost burden section. Again, we have a small note describing what is housing cost burden. And then we have 2 visualizations on this page. The first one is percentage of cost burden households, which basically shows if housing costs more than 30% of the total household income. And using this visualization, we see that 58.5% of Native Hawaiian and other Pacific Islander alone renters are cost burdened. On scrolling down, we see there's another visualization which shows percentage of severely cost burdened households, which is basically the percentage of households with housing costs more than 50% of the total household income. And here we see 35.9% of Native Hawaiian and other Pacific Islander alone renters are severely cost burdened. And this chart also shows us that that is more than other racial categories. After we are done viewing the dashboard, in a similar manner, we can go back using the yellow button and choose another county or topic in which we are interested in. So this was a dashboard walkthrough. I'll go back to the presentation, and I'll also invite Julie Young, who is a graduate student at UCLA, and she worked with the lab on making the dashboard mobile friendly and also on the housing cost burden section. Julie?
Yes, thank you, Shreya. So good afternoon, everyone. My name is Julie, and I'm an MPH student in the Health Policy and Management Department here at UCLA. And today I'll be just speaking briefly about my experience working with the lab and also introducing the new housing cost burden section that we added as part of the dashboard launch. Next slide, please. So I had the opportunity to work with the NHPI Data Policy Lab through the Steve Wallace Fellowship. And through this experience, I've learned more about the importance of data, equity, community-centered research, and the role that disaggregated data plays in public health and policy. And as a part of my work here, I collaborated with Shreya on data analysis and formatting the mobile versions of these dashboards. And this experience has helped me better understand how powerful these data tools can be. And these dashboards help make information more accessible and actionable for community members, researchers, advocates, and policymakers. Next slide, please. So why do housing costs matter? As a part of our dashboard launch, we added a new housing cost burden section because housing affordability is a major issue affecting many NHPI communities in California. And so housing cost burden refers to households spending more than 30% of their income on housing expenses, while households who spend more than 50% are considered severely cost burdened. And these measures are important because high housing costs can affect financial stability, food security, stress, and access to healthcare. And so we wanted to focus on housing because affordability has major implications for long-term stability and well-being. Many HPI households face barriers to home ownership, and high rental costs can make it difficult for families to save and build wealth. And housing costs may also disproportionately affect NHPI communities because many households are multi-generational or include extended family members, meaning financial strain can impact multiple people within one household. Next slide, please. And so why add the housing cost burden section? This is especially important because migration patterns for many NHPI communities are closely tied to economic opportunity and cost of living. So some families moved to California seeking better opportunities, while others were pushed out of their home islands because housing and living costs became too expensive. At the same time, rising housing costs in California may continue to shape where these communities are able to live in the future, potentially pushing families further inland or to other states with lower costs of living. And we also included this section because home ownership is often viewed as a pathway forward or toward long-term financial stability and wealth building. However, NHPI communities in California are more likely to rent compared to the overall state population, and high rental costs can make it difficult for families to save towards home ownership. Next slide, please. And so just the purpose of the dashboard data is to increase visibility around housing inequities affecting NHPI communities and provide more accessible, disaggregated information. We also hope that this section can support advocacy efforts, policymaking decisions, and affordable housing initiatives. It can also help community organizations strengthen funding requests and program proposals by providing data that highlights the specific housing challenges facing NHPI communities. And next slide, please. And then as Shreya showed you before, this is just also a quick summary of how to find the housing cost burden section. Again, it's just found after you select your county on the first part of the dashboard, you scroll down and you'll find the housing cost burden section under the housing section. And yeah, next slide, please. And then thank you again to the Data Policy Lab team for this opportunity. And thank you all for being here and taking time to learn more about this work. And so I'd like to welcome the NHPI Data Policy Lab Project Manager, Kristen Marquez, who will be facilitating the audience Q&A.
Aloha mai kako. Oh my gosh, what a beautiful share from everybody who I'm like now I'm gonna cry too. So thank you for everybody who is here, who is interested in our advocacy and this tool. I wanted to we have time for just maybe one or two questions, and I know Calvin is busy answering some of the questions in the chat, but we did have one from the chat from Val Jacobo, which was, can you choose multiple counties? Which is a great question. And yes, please, if you have any other questions, you can drop them in the Q&A function, and we will do our best to answer them and include them in what we send out afterwards. So as far as can you choose multiple counties in the dashboard itself? I'm going to actually direct that one to Sharia. I don't believe that that's a current capability, but maybe Sharia can help.
Yes, currently we can't select multiple counties in this dashboard, but that's a helpful feedback. Maybe in the next iteration, we can have something like that to select like 2 or 3 counties together. Thank you.
Okay, and then from Tiffany Hautau, I noticed that the CHISH dashboard, there are areas and questions that show suppressed. Can you explain what that means? I'll send that to Kelvin.
Yes, so the CHIS dashboard relies on information and data from the California Health Interview Survey. And the California Health Interview Survey is a probability sample. So it does have some limits in terms of the number of NHPIs that respond to the survey each year. And for privacy reasons, unfortunately, the California Health Interview Survey isn't able to share some of the responses from populations that are a bit too small, so small that if their responses were revealed, it would potentially allow for their identity of the respondents to be revealed as well. So we are relying on the CHIS team's suppression rules, and we can share that with you if you'd like.
Okay. And it looks like our last question is from Yoko Namasaki. They said, thank you very much for the excellent presentation. Is the raw data or the CSV available for research purpose? I'll send that to Shreya.
So the data sources that we use, they are mostly publicly available data sources. So you can definitely go and get the spreadsheets directly from like Census Bureau or from CHIS. Like they have Ask CHIS dashboard, which can help you download the data on your computer with a few clicks. But if you need assistance from the lab to get some of these data in the form of spreadsheet, we can definitely help you in the form of a technical assistance. That is basically reach out to us and we can see what we can do to help you. Thank you.
Okay. And it looks like there's actually just one more question. Calvin, I know that you're in the middle of typing it, but if you want to go ahead and maybe just answer it live. The question is, how do you address the issue of small numbers, which I do think that Shreya partially addressed, but maybe you can expand on it.
Yes, I actually just wrote in typed out a response. We run into issues regarding small numbers because we either have to suppress those data because we run into privacy issues, or because the small numbers result in statistically unstable estimates. And we don't want to mislead anybody by providing unstable estimates. That could change drastically if only a few more NHPIs were to respond. But we did want to make sure that even if there are numbers that are too small to report, that we label that data as either suppressed or unstable, because it shows that the data for our communities is still being collected. Like there is a category that people can use to respond, and it provides an avenue for advocacy for our community organizations to ask for and to ask for consideration for improved ways of collecting our community's data, to improve the number of respondents from our communities, or if perhaps even alternative means of collecting our data should be considered. But at the very least, it shows that our data is being collected, but we simply need more of it.
All right, well, I think that's all that we have for today. And then I'm going to pass it to our director, Calvin, to close this out.
Yes, if that's all in terms of questions, I really appreciate everybody for attending. We're very happy to have you, and we hope you check out the dashboard. Thank you for coming, everyone.